when I was studying in Jodhpur, we went to attend one camp. And there, when we went, that one small girl came with an old person, I think their grandfather. And she came and said, "Doctor, he is not able to see. Can you give him sight back?" I said, "What about why your father has not come?" Weepingly, he told me that, "Sir, my father is no more." On that day, I felt that no, eyesight is very important.
How true is it, and what is something that people of today are really ignoring about cataract that they need to know?
Cataract is big spectrum.
If you can share some insights on how does diabetes really impact an eyesight or a vision?
Whenever the diabetes is there, the oxygen carrying capacity of the blood is less. Another myth is there, I'll tell you. Once you start wearing the glasses, means it's never, then power won't increase. Sorry. If it is for near glasses, as the age advances, it will increase. If it is a myopia in the kids, up to the age of 20-22, definitely will increase and slow, then it gets stable.
That eating carrot is very good for your eyes, or keeping cucumber also on your eyes cools your eyes, or taking other additional vitamins also helps your eyesight improve. So how true is this? Do they really work?
From last 1 or 2 decades, hardly we are seeing 1 or 2 cases of vitamin A deficiency.
Dr. Narpat Solanki sir, it's an absolute pleasure to have you with us, sir, today.
Thank you, Ankita.
So to begin with, I would like to straight up go back to 35 years journey that we are here for. So 35 years back, what you started, which was called as a specialized cataract center, what did the eye care really look like back then in Bangalore, and what is it today? What is the difference that you've seen?
Ankita, I'd like to tell you that the journey is always not a smooth journey. Always it has the zigzag. And sometimes what happens that you want to do something, but destiny doesn't show you. So I'll tell you now, exactly, I don't want to be a doctor also. My first preference was to as a chartered accountant, because my father was chartered accountant. But my father pushed me that, no, you do the medicines. We want one doctor to be in the family. And he pushed me. Unfortunately, I appeared twice, but twice I didn't got the seat. But third attempt, he pushed me again, and then I got the seat. Then I finished my MBBS and MS from Jodhpur, Rajasthan. And my dream was to become a general surgeon who can give a big cut and more sutures. So that was the dream. At that time, everybody was saying a general surgeon is a big surgeon.
Right.
But destiny sometimes pushes you back. I didn't got the general surgery. In my third attempt, I got the ophthalmology. I think that is the God wish. Because I know now why God has chosen me for that. Now coming to that, I started my MS, and after MS, I was there in Gujarat for nearly 1.5 years. Then I came to the Bangalore. Once I came to the Bangalore, few of my friends we were all classmates, so he was there. They said, "Please come here. We all will be together only." Then I took a call, okay, come. So when I came here, I don't know what I to do it, because I don't know the Kannada here. Only the few people, and my English was okay. So, but they say, don't worry, this is a cosmopolitan city and you will be able to learn all the things. And I started my clinic in November 1987. With the 2-room clinic. I started with the 2 people, me and one of my assistant. We used to do all the work. And slowly we grown. And then we went to the 4 rooms clinic with 1 operation theatre, a small operation theatre, and then we started. Then we goes on adding the people. So then we will have about 13 people out of the 3 doctors, and other people were just supporting. So that was the all game changer there. When I started that, my clinic was just a general ophthalmology, where we used to do more of the refractions and few of the cataract surgeries. And as you mentioned about the cataract surgery, at that time cataract surgery was there without the lens. Means there was no IOLs. So we used to remove the cataract, put the sutures, and give the very thick glasses. But when I came here, and after 3 years, I feel, no, this is not the right thing, we have to do it. When the other people are charging huge just to put an intraocular lens in the eye, why a common person cannot? There we had a discussion. I said, no, the person need not to be visually rehabilitated. He has to be parallelly occupationally rehabilitated. So that's the motto I took it, and say no, whosoever is able to pay or doesn't able to pay. So, but we used to put the lenses, and that is we have changed the total view here in the Bangalore. In my camp patient, I'll tell you, because I am known for my community services. From 1993 onwards, I started doing my camps, and till date we made more than 6,000 camps we have done it, and in that more than 25 lakhs patients we have screened, and 3.5 lakhs free surgery we have done it. But the game changer was this only, that when we are doing the cataract surgery for anybody, we need not to see that who is he. When he say that he is a paid patient and he is a free patient, or he is a subsidized patient, if you keep that one in mind, I can tell you that we are not doing the justice. God will never forgive you. So this is the motto when we started. And we went to the, after the 10 years of my first phase, when we shift to the another clinic, there we started in 2001. I started the Project Drishti. Core to my heart, I'll tell you. Project Drishti will started, and we started doing the camps. In the first year itself, we had done 25,000 free surgeries. That was a phenomenal. And for this, my recognition and this service, Government of Karnataka gave me the Rajyoswa Award. I think I was the youngest in the doctor series that who get it that time. And then we goes on. But the crux of the thing is this, that whenever you are doing anything, you are serving the people, you should not feel that the money is the only criteria. Yes, money definitely require. And what we made it, that quality services at very affordable prices. That was our mantra. And that is our catchword, is also the Simply Eye Care. Why the Simply Eye Care? That we want to make the things simpler rather than complicated for anybody. If I speak in their language, if I speak and tell them that no, this is the simple disease, don't worry about it. If I don't go and tell him and make him more fear that no, it can happen, then what will happen? They will have a lot of fear, and God knows, he may say, no, I don't want to go for it. But we have made very straightforward, very simple. And that is the reason why we are there. And in 2003, when we started my project is 2001, and 2004 we shifted to another building. See, I goes on jumping from one place to another place. I was not having too much of the money. I'll tell you, when I came to the Bangalore, it was only few hundred rupees was there in my pocket. And all my relatives, friends, they helped me. I was staying in their houses, eating one meal here, one meal there, like that only. I was a little bit stubborn that I don't want to take the help from my parents or my all known people. So I think that stubbornness is still there with me. And that is my quality also, because whenever I take something in my hand, I have to do it, means I'll do it, whatever it may be. So when we went to the near, and then we expanded our services beyond the cataract. Always I say beyond cataract. Cataract is one which, most of my colleagues are doing it. But when we went beyond the cataract, means then we started with the retina, glaucoma, refractive surgeries, and all that we have started. And then my one passion was there, that knowledge should not be kept. It should be distributed. You have to share the knowledge. And with that aim, we have started giving the training to the existing doctors or who are practicing doctors, and who are not exposed to the latest techniques. So, for your surprise, Ankita, I'll tell you, we had done more than 300 cataract surgeons all over the world, not only India, all over the world. We have trained them in the advanced cataract surgeries. And this is our, I can tell you, my hallmark is this only. Here, if you go, they will share the knowledge, small things they will tell you. And one thing is there, always I tell my training, don't worry, I am there. Don't worry, I am there. So you need not to worry. If anything wrong happens, we are there to help you out. So that fear factor is not there. Then it is still we are having the long list of the doctors who are in the queue to get it trained in our hospital. So this is my small journey. Then last 5 years back, we have extended from cataract or eye surgery, eye to the next level. Then we have gone to for a body. So we have started one hospital called Jain Mission Hospital in semi-urban area. That is our Chikbalapur. And I think we are doing wonderful work there also. Our aim is very simple, that economy and the perfection and the professionalism should always be there. You should do justice to the patient. Don't see that patient is a cash cow. No, never. If he is able to pay, you please take it. If he is not able to pay, at least you see you cannot do it, you say, sorry, I can't do it, but God will help you. We will give you the another way where you can go and get it done. So this is my whole journey. And I got the two sons. One, he's joined me, Dr. Priyank Solanki. Another, my son, Mr. Mayank. He is in the education. We're doing value-based education. So I'm very, very proud. So I'm a very happy person. I can tell you that I'm the blessed one. Definitely, I'm the blessed from the God that He has given so many things to me. And whenever I require anything, the God has given me. I got 100 examples. If you want, I can give you one example. That is when I was about to go to Rajasthan for my annual camps. I like to tell you that from last 25 years, we are doing the free eye surgery camps there in the Rajasthan, my native place. And at that time, there was no money with me. And I think maybe a few hundred rupees was there in my account. So, my salaries were due, this and that. So before going, I went to the God and said, Bhagwan, whatever you want, I am going and you look after everything. You don't believe that once I came out of the clinic, one person came and he told me, sir, where is Dr. Solanki's clinic? I say, sorry, he has already left. I thought that, he might have again came for the consultation. I have to leave. Then he said, what is the work? No, sir, I can only talk to him only. So I took him and I said, yeah, please, I am only Dr. Solanki. Sir, this is 1 lakh rupee check is there. So I want to give you. Why you want to give me? Okay, no, sir. Some of the person recommended that this is the hospital we are doing the good charity. And so he recommended you please go and give it. You can't believe that you have the hundreds of rupees and then 1 lakh rupees suddenly it came. That was enough for me for the 2 months salary for the people. So it is not happens once, I tell you. There's lot of time it has happened. And one life-changing story I'll tell you. When I was studying in Jodhpur, we went to attend one camp. And there, when we went, that one small girl came with an old person, means I think their grandfather. And she came and said, doctor, he is not able to see. Can you give him sight back? I said, what about why your father has not come? Then with a very weepingly told me that, sir, my father is no more. He is the only earning member in my family. And he also now is not able to see. So we are in a trouble. On that day, I felt that no. Eyesight is very important. And if you can help these type of people, you need not to go to the God also. God will bless you every time. And this we have done not only once. I told you that nearly 3 lakh surgeries we did it. But definitely out of that, 10% of the people who are really required, very badly required, the surgery or their treatment, we did it. So there are a lot of things which happens in the life. In my journey, lot of experiences came, lot of good things has come, bad things has come. And here I like to share one. You may not believe that my both the sons, I never gone to their school. I never went to their school. I never attended any parent meeting. I never attended their annual functions. I think that I had not done justice to that. But I feel that because on that day I might have had some important work, like I had to go for some camps. And my out of the 52 Sundays, I can tell you my 50 Sundays are for my community service only. So this is the life, and I think I'm very blessed. And because of that, God has also helped me a lot. Tan, man and dhan, what you can tell. All the three things I can tell you that we have been blessed. Wherever you go, recognition there and people are helping us. And my wish is that till I am there, I should continue this work. So this is very small brief about my life. Thank you.
It's quite moving, I would say, sir. In fact, the one statement you made that, the people who you were training, they always remembered you, that you're always there with them. I think my grandmother, lucky enough to get the surgery done, cataract surgery done from you.
Oh.
So I still remember whenever I do, she knows, oh yes, the Dr. Solanki sir, even then I think you had told her that we are there with you, don't worry about it, because she also was a scared person during getting the surgery, and she telling me that statement, and now I can totally relate to that when you're sharing this bit. Quite a moving and inspiring journey, I would say, sir. So as you mentioned, now right from just being a cataract center back then 35 years ago to now providing different kind of surgeries, whether in LASIK, retina, glaucoma, pediatric, ophthalmologist, or many others, how did this growth happen? Is it like, was it planned in your journey, or is it the patient's need drove it? Like you saw patient with those diagnoses that you had to push yourself to bring those surgeries. How was it?
I'll tell you first, my first statement is there that I never planned anything in my life.
Okay.
Everything, step by step, it came forward and then we accepted it. So that is the way. When I started my clinic in the Bangalore in 87, as I told you, it was a normal eye clinic.
Right.
I never thought that I will go up to that level. Okay. But as the time passed, and my passion was there to help the people, as I told that in my student life, I had certain this accident. So I said, okay, if I get opportunity for somewhere, I will not miss it and I will do it. And then the time came that people came to me and said, we want to conduct one eye camp, especially with the Jain communities. So once they came and said, okay, we'll do it. And from that time onward, when we starting doing camps, or then we started the patient used to come, and I was a cataract surgeon, and we had to used to do the glasses and small things we used to do it. But whenever some retinal problem is there, glaucoma problem is there, squints are there, then I say, sorry, I'm not doing it, I'm sending you somewhere. The people were very reluctant. No, we don't want to go. I said, okay, fine, sir, you call somebody. In your presence, if you want, we can do everything. Otherwise, I know. So that was the faith. Then I saw here when so many people are there, and I'm referring them here to there. Then we expanded and we called other colleagues, and then they joined us, and then under one roof we started. So in the last these 35 years, we have almost covered everything. Not only the cataract, refractive surgeries, glaucoma, squints, then you can say retina. Everything we are covering under one roof, and that too on very professional basis. Ours is the center where we say surgery is the last. I'll tell you, surgery is the last. If it is manageable with the medicines, glasses, or any other way, we say, please try this one. If it is not, then definitely surgery is the last resort. So this I'll like to tell you. Many times the people comes with a lot of reports, and they don't show us that report, and they tell us, sir, you see what is there in that? I say, okay, you are having the little bit cataract. Sir, is it to be urgent? I said, no, you wait for it. You can wait till you are able to see clearly. Whenever you are having the difficulty in the driving or reading, also, you can just come, we'll do it. Then they show me the reports and say, sir, I went there, said, today only if you're not done, you will lose the eyesight. Like, who nonsense, it told like that. Then say, no, it is there. I say, they might be in the need of the money very urgently. Those might have done it. But this what we call simply eye care. See, we don't want to make anything very urgent. Emergency, if you don't do, you lose your sight. Never. And this is the principles in our hospital. If anything is an emergency, it has to be discussed by two people, and then we are to decide. It is not that, okay, I am doing it. Yes, many times people come with for refractory surgeries, but yes, I can tell you that they will come because they are coming only for that reason only. So the part is different. But cataract, glaucoma, and retina, these three things we always first give the trial with the medicines or any other things, and then we go for it. So that is there. So and definitely we are doing good oculoplasty also nowadays. I had done more than 1,000 squints also.
Wow.
Though I was not trained in that, but slowly we learn, and then we are doing it. But now I loved it.
So then there are two things very interesting that you spoke about, and I have two follow-up questions on it. So one being, like, as we usually know as patients, right, like any common audience, always when they identify there's something wrong with it, they try to research which hospital to go to or which doctor to go to. So how do you think can people really decide which hospital and which doctor is the right one specifically when it comes to, say, eye health, right? How do we go about that?
I like to make a very common statement. See, I don't say anybody is wrong or unprofessional. Yes, everybody has done the degrees. They are doing the work. Only as you told that how to choose it, there are certain parameters are there.
Okay.
So there, the one is the parameters, the legal parameters are there. Nowadays, the NABH is one. Okay. This is the it's a national accreditation board is there, which sees that whatever you are doing in a hospital, it is patient friendly, patient safety, doctor safety, and legally it is correct or not. Right. So if anybody who is having the NABH, you can definitely say that, yeah, this is the one institute where they are following certain procedures, certain line they are following and then doing it. So this is definitely one. But beyond that one is, I'll tell you that you should research about the credibility of the doctors. Credibility of doctor means there is nothing wrong in asking another colleagues or another fellow or your patient that what is your experience. So as I told you, that everybody is doing the good work, but a few people only see this is a profession where I have to earn the money also. Few people say that no, I have to do the research on these patients also. So there is a lot of other things are there. But for the patient perspective, if I'd like to tell you, see for the accreditation, number one, and then you can see that what is the antecedent of the doctor. Okay, satisfaction ratio and confidence of the treating doctor is very, very important. If you see that he is always talking in eye to eye, and secondly, he gives you the proper treatment and proper advice first. Treatment comes later on, but first is advice. Where do you feel that, yeah, he is giving the right advice? Yes, definitely you should choose it. Yeah. So this is one. But I never say that if a single doctor clinic and a 100 doctors hospital, yes, definitely both are good. So, but anytime what happens, you have to take a call because sometimes it's a personal call.
Yes.
Yeah, so that is the way. But I like to tell you that my retention rate of the patient, I will tell you, is about more than 90%. 90% by all are the patients who come back. So that is one thing which I feel.
That's an impressive statistic, I would say.
90%, yeah. So
lovely. So then you spoke about cataract as well, because that being your still being your foundation, right? And you personally have treated about like 5 lakh plus patients for the last 35 years. So I somehow happen to hear a lot of myths around it. Like it happens to only people who are very old, or you have to live with it. You can't really do because it's just the old age that it hits you with that, right? So how true is it? And what is something that people of today are really ignoring about cataract that they need to know?
See, cataract is a big spectrum. Many times we see that it's early cataract, moderate cataract, mature cataract, immature cataract. These are the terminology we used to use before.
Okay.
About 10, 20 years back we used to. Nowadays it is not. Now we are just only asking the patient, are you happy with your vision? Are you able to do all of your work? All of work means if a lady is there, he is able to do his household work. If any professional is there, whether he can drive the vehicle, he is working on the computer, on his day-to-day activities are finding the difficulty. If anybody says that I have difficulty, and if you see that little with cataract, it can be done at any moment. It is not that it has to be ripe or you have to wait for 6 months, wait for 1 year, 2 years, nothing like that. So nowadays, from the vision or to it has gone to the need. Because the success rate of the cataract is what I can say 99% success rate is there. Even if it is little bit more, but keeping 1% just for a legal sake. So any surgery in the body, I'll tell you. So cataract is the one which is the most performed surgery from top to the bottom. And success rate is also too good, means 99% no surgery is having. So there is the first thing is that people are having the fear, after cataract surgery, if I lose my sight. Yes, I will say 99% there is no way. If you are going to lose the sight, there are the certain other factors which usually doctor tells you if he's having pre-existing glaucoma or if they are having the diabetes, something like that, or they are having the age-related problems, infections are there. Those cases which comes and fit in the 1% which I told you that they may not. Usually doctors tell you, or I tell them, okay, this is the probability there, 50%, still there is a chance if the 50% is not there. Only I say no when I feel that hardly he is going to be benefited, then I say better you live with that only. Otherwise, I always try and see that what best we can able to tell.
Okay.
Huge miracles are there where people has been told that no surgery is possible and we did it and patient got the good vision. But at the other side also it is there that we expect that something very good will happen and some expected result didn't came. So it is part, but no one I like to tell to all the people that don't worry about the cataract, then cataract surgery is most safest one. And if you are going toward the good surgeon with the good equipments and good support, there is nothing like that. Always I give a very, very simple example. If somebody is driving the car on the road, so what you have to say, good road is there or not? Then you say your car is good or not. Then you say who is the driver?
Correct.
All the three things make a difference. If the roads are bumpy, definitely you can see that it will take time or it will take number one. If your vehicle is not conditioned well, definitely you will have the problem.
Suffer,
and if a driver is reckless, definitely. But if all the three things are good, why I should say no? You will not reach in the time. Good road, good vehicle and good. So the passenger is safe.
True. Definitely. I mean, very good analogy that way I would say so. So, because it's your 35 years long journey that you've spent with so many different kinds of patients that you've talked about, right? Very interestingly, you mentioned about diabetes. For our audience, maybe if you can share some insights on like how does diabetes really impact an eyesight or a vision, and what is something they really need to stop doing before it becomes a huge problem?
I'll make it very simple.
Yes.
Okay, not too many medical terminology and all that. See what happens whenever the diabetes is there, the oxygen carrying capacity of the blood is less.
Okay.
Number one. Whenever there is less oxygen in the body, but eye, arteries and veins, eye is very, very sensitive to all this.
Okay.
So the first effect comes in the eye.
Oh.
That when there is a less oxygen supply, what will happen? The brain will say, yes, we want to pour more blood in the eye so I can see or I can work or function properly. But if the sugar is not under control, it is going more than 200, 300, 400 and all that. And then what happens? That slowly the retina get diseased. There is a formation of new vessels. The new vessels mean that is very, very fragile. So with the smallest trauma, it can bleed. So what we call it is a diabetic retinopathy. So now in diabetes, what happens that why eye is most important is that because as I told, eyes, arteries and vessels are very, very fragile. So this is one that one has to be very careful for diabetics. What is the most important part is that they have to keep their diabetes level under control. Control in the sense that I never say very strict control, but it should be control. Very strict has got its own side effects. But normally if there is sugar level moves between 120 to 180 or even maximum up to 200, usually they are safe. And diabetes affects the eye usually after 7 or 8 years of the existence.
Okay.
It is not that day one it will be about 1 or 2 years. But it doesn't mean that all the people after 7 or 8 years, they will develop. No. There are all genetic factors. I've seen the people who are having the diabetes. Yesterday only I operated one patient, day before, sorry. That is on 35 years of diabetic. So definitely we can expect something, but nothing, not a trace of diabetic retinopathy. And they are the young people, they come and they say 3-4 years diabetes and they are having a lot of bad diabetic retinopathy. Then we know that he was not knowing. So both the things are there, but very thumb rule is that diabetic should be under thoroughly controlled, number one. And you should get your eye checked. Every year once. If there is no diabetic retinopathy, if the diabetic retinopathy is started, then definitely people will say that every 3 months you have to do it, or every monthly you have to do it. They have to do the follow-up. If anything is happening because of diabetes, maybe bleeding is happening, or some cholesterol, or you can say what we call it exudates is happening, and if we want to seal it with the laser, we can do it. Otherwise, you get the injections and all that. So these things are very important. Here I like to mention one thing more. Usually diabetes and the hypertension is both diseases go together.
Okay.
The person who is having the diabetes and the person who is having the hypertension both, it is said that the blindness ratio in these people is 25 times higher than the normal if the disease are alone. Now you see the misery. Most of the time what happens, he is having the diabetes also, he is having the hypertension also, and both are not in control. So definitely risk of getting the blind in these people is much, much more. My request to all the people who are having the diabetes or if they are having the strong family history of the diabetes, they should not ignore these signals. They should not ignore the diabetes at all. They should go and check their eyes regularly. Same thing when you go to any of the nephrologist, or they say that, okay, you are having some kidney problem, we'll send next to, say, first you go to the ophthalmologist and get it done. The reason is that he cannot see the blood vessels directly in the kidney. But we are only the organ in the eye where you can see direct vessels, arteries, veins, we are seeing directly. Here if you see, all the blood vessels are covered with the skin. There it is the retina. So that's why we can say that what kind of vessels are there, where the bleeding is happening. If the bleeding is happening here, it may happen anywhere.
Definitely.
So these are the things which is most important, which people usually forget or neglect. Both the things are there.
Definitely. So because you just mentioned that, one is diabetic segment that we are talking about, but in a lot of areas sometimes people tend to ignore a lot of things, or they tend to do a same mistake over and over again. So what would those mistakes be, and what would you want them to correct their actions on? Common mistakes maybe.
See, common mistakes, what happens if the diabetes, as I already mentioned it. Now, another thing, what we have observed, that when anybody crosses 40 years of the age, and then they are having the problem with the reading. So what they used to do, they will just raise the distance, and they used to see.
Right.
Then say, then they started getting headache or so, and then say, what has happened? So what I like to tell you, that usually the chart is that after 35 years of the age, every year should go for your checkup, eye checkup. So this presbyopia, as I told you, that reading glasses will come definitely. And another myth is there, I'll tell you, that once you start wearing the glasses, means it's never, then power won't increase. Sorry.
Yeah.
Both the cases, I'll tell you, it will increase. If it is for near glasses, as the age advances, it will increase. If it is a myopia in the kids, up to the age of 20-22, definitely will increase, and slow, then it gets stable. Okay. So Pilotu will come after that only. Here also, when you start having cataracts, so Pilotu will come. So both the things, people should not get worried why power is increasing. I'm just debating, but I'm telling that especially for the kids, when they are not able to see on the board, and complaints come from the school. But I'd like to tell you here the fault of the parents also. They are seeing that kid is going next to the TV again. When you pull him again, he will go back. Then you should have something is wrong is there. And once they come and we say that, okay, this having the -1 or -2 diopter glasses power is there. They say, Dr. Saab, if we put it now only, power won't increase. I say, sorry, it will increase. No, sir, what to do? I say, then very light moment I will say, do one thing, I will stop your this power, but at the same time you have to see that his height should not increase. That's how we can do it. Then say, sorry, you can't do it. I also can't do it.
Right.
Okay, because this is all age-related factors.
Absolutely.
It's the growth factors. So I'm telling that don't worry about it. If it increases, then it will get stable. And after the stability is coming, you can go and get it corrected. You can come for any refractive surgery. LASIK is there. You are having ICLs are there. Anything is there. We can do it. But right now, you should not get worried about it. And people say, can I give more carrots? Can I give more vitamin A? Can I give this much? Or shall I avoid him not to see the TV? I say these all are the additional factors. not the main factor. Main factor is the age only.
Correct.
Only thing many times what happens that if anybody is having the glasses is not wearing it, then what happens? He has to squeeze the eye like this. Then what will happen? The power increases faster. Because they are straining a lot, so I get compressed. And I get compressed, the chances are there, maybe 10, 20% or 30% power may increase more. That's all. But let him be aware what is wrong in wearing the glasses. When the kids is happy to see the things, he can, he will do the good things in the class also.
Right.
Usually, the teachers catches these people, how the same mistake is done by both the neighbor student. They are doing. So they are doing just see what he's writing, he's writing. And he also does that. So then they will got copied and then what is this? So like that only many things are happening. So what is my suggestion to everybody, if your family members are having the glasses, any parents, a father, mother, grandfather or grandmother, maternal side, paternal side, whatever it may be, if they are having the glasses for distance, they should get their kids' eye checked at the age of 3 to 4 years, 4 years the minimum.
Easy.
And then if it is nothing is there, you should go and distribute the sweets. If it is there, you should be thank you. At least we got it and my kid will get it the proper treatment that time.
Yeah, better. Timely consideration, I think, is very key. Because right now in your conversation, very interesting thing you mentioned and which I wanted to check with you also on. Because again, a lot of people around me have been talking, even as a kid I've heard this, that, eating carrot is very good for your eyes, or, keeping cucumber also on your eyes cools your eyes, or taking other additional vitamins also helps your eyesight improve. So how true is this? Do they really work?
No, I'll tell you. See, this vitamin A theory has came when we were studying at that time. We used to see a lot of people who are having malnutrition and vitamin A deficiency. Now, from last 1 or 2 decades, hardly we are seeing 1 or 2 cases of vitamin A deficiency. See, this myopia and all that, they are not the deficiency disorder at all. These are the other things, color differentiation or color blindness, or sometimes weakness, where eyes are very dull. These are the vitamin A. So I'll suggest that not unnecessarily force the kid to eat more carrots or more papaya or take this vitamin, that vitamin, because this is nothing to do with anything. If your pediatrician say he is having deficiency, yes, fine. But not as a myth, they have to take it that it has to be there. So people will give the badam also, they people will give more milk also. So don't unnecessarily push the kid for all these harsh activities. Okay.
Yeah,
so this is one.
Do not give your own treatment until and unless consulted. As you said, it's important to get it checked even before considering something.
Here I like to mention one more important thing, which is unfortunately is very rampant now. It is the Google uncle or WhatsApp university. These 2 things I'll tell you, I'm not against that one, but what I'm telling, you will not be able to judge which is right, which is wrong. Just people put it for fun or just to get some likes and this and that, and which is creating a lot of problems. Please, if you have got any doubts, go to a authentic person, maybe any ophthalmologist or who knows about this, and you ask them. Then you please try to do it. I'll tell you the many things about this treatment, that treatment. You are giving green vegetables, you are doing this one. Yes, green vegetable is good for the health. Your vitamin, cataract and all this good for health, but don't give the over. Otherwise, you will have the what we call the hypertoxicity also.
Okay.
Hypo and hypo, both are things. Hypo means when it is less. Hyper means we are taking more. So nowadays, many times we are seeing the vitamin A toxicity. A toxicity which damages your liver.
Okay.
If they go on pushing. Previously, yes, definitely what was happening about 30-40 years, malnourishment was the major cause of the illness in our country. Now, hardly we are able to see. Hardly. This is, and I can tell you, we should be proud. We say that we are eradicated a lot of things. So this is one. And another thing I like to tell you about this uses of the computers and the TVs. Because this is a very, very burning now
Issue,
issues are there,
yeah.
because these two things. Now we know that kids cannot live without their monitors, because all the education is there only, but still they should observe certain hygiene.
Right.
What we call the ocular hygiene. And what is the ocular hygiene is that whenever they have to see any monitor, so they should have this 20-20-20 formula. And what is the 20 formula is there? The first is, means any of your monitor is about 20 inches from your eyes. Then comes to 20 times you have to blink your eyes. And then after 20 minutes you have to give little rest. Okay, the three things, 20-20-20.
rules.
So this 20-20 rules is going to help. Many kids in the type of exams, they will come and say, no, I got the headache. See, your capacity to run only for 2 kilometers, but now you are running for 6 kilometers. So definitely you will get tired. The same thing is happening in the cases of eye also. Because I say that whole years I have worked only for 2 or 3 hours for the reading and all that. Now suddenly you go for the 6 hours. I say, I am tired, I am tired, I am tired. So in that case, what they can do it, okay, you have to say, read for 6 hours, do it. But give some small gaps in between. After half an hour, 45 minutes, you just off the computer, just go and take one round and come back. Maybe 2 or 3 or 4 minutes, that is enough. So what happens that whenever you are seeing anything near, your eye get fixed, or the muscles get spasm. And once the muscles get spasm, what happens? Then you feel that it is clear. But when you see distance, everything is blurred.
Blur. I think it's common with
So that is for everybody. So what I am telling that you have to just give little time. Maybe after 45 minutes, so your eye get straight again. Once it get strained again, your strain and all it will come down.
Right.
So these are the few tips I like to tell that what exactly they are supposed to do it.
I mean, quite insightful, because as a working professional also, I think all of us also very commonly face this issue, but really do nothing about it. So thank you so much for sharing this. Now I have a very interesting segment, which I would like to say to have a quick eye check, not like a literal eye check, but to get the focus on the myths versus reality. So are we ready? I have a couple of questions that I'll be shooting, and I would request you to answer it in true or false, or it's complicated statement, and the reason why do you say so. So are we good to start then?
Yes.
Yeah, just a second. So, we were talking about cataract surgeries, and you did mention that, now the technology has really grown vast. There are different kinds of lenses also that has been used. But how do one decide what is the best lens that they can actually have it for their surgery?
No, this is the $1,000,000 question, that whenever somebody is having the cataract or anybody is having the cataract in their family, and when you comes and doctor says, yeah, you have to go for the cataract surgery, then definitely we'll say, what is after removing the cataract, we are going to put another artificial lens. And then definitely comes in the mind that, what is this artificial lens? Then I say, okay, just go to the consulate and talk to them, they will tell you. But here the thing is that I'll tell you that there are basically two type of lenses there. One is the rigid lenses, another the foldable lenses. Now rigid lenses are almost out of the picture, because rigid lenses we were doing in the 20 years back, when we used to make a big incision, put the sutures, and through that we used to put the lens. Now the advent of the phaco and small incision cataract surgeries, where we are really making a very small incision in regard to the size of the lens. So what we'll do that we fold the lenses and put them on an injector, and then inject inside, then where it goes and unfold. So these are the foldable lenses.
Okay.
So now this is the one just for explanation that what exactly foldable lenses. Now in foldable lenses also we are having a different kind of lenses. Now what are the different kind of lenses? One is material based, and secondly their working. First, I will go with the material based. Material based means that hydrophilic lenses and hydrophobic lenses. Hydrophilic lenses are which are having the more water contents in that. Okay. And hydrophilic lenses are there which are having the less water content. And then what happens that it has been observed that hydrophilic lenses have got more tendency toward the PCOs, what we call it, the opacifications. But in the hydrophobic, there is hardly any chances are there. But what we call it, the hydrophilic lenses are more natural lenses. because it
Okay.
contains more water in that.
Hmm.
But hydrophobic lenses, they are more rigid than hydrophilic lenses. But once it goes and sets in place, it never moves. It doesn't move.
Hmm.
And the gap between the posterior capsule where we put the lens and the lens will be highly negligible, and it doesn't allow the cells to grow again. So these are the two type of things. And third one was there, the silicone lenses.
Okay.
Those silicone lenses now again out of the picture. I think from last many years we have not done any single case of the silicone lenses. Now coming to, as I told you, the visual outcome. So what is the visual means? One is the monofocal lenses, then come intermediate lenses, multifocal lenses, and trifocal lenses. So these are the different actions. Monofocal lens means the person will be able to see for the distance clearly, and for near he has to wear the glasses without fail. Without fail, I'm telling you.
Okay.
Then come the multifocal lenses. In multifocal lenses, people will be able to see near also and distance also, but intermediate, maybe another maybe 20 inches or so. Afterwards, they will find the difficulty, especially when they drive the vehicle or ladies are working in the kitchen. That distance, they feel that is blurred. Okay, so but multifocal lenses are good for distance and near. Now, then afterwards, when this difficulty started, then people has come with the new lenses called trifocal lenses. So trifocal lenses are that it covering all the three places for distance, intermediate, and near.
Yeah.
Okay, but be careful. Every lens has got its advantage and disadvantage. Now, as I told you, in monofocal lenses for distance, it will be very clear. Near, he will definitely wear the glasses. Multifocal lenses, they are having the distance vision, then near vision also, but intermediate lenses is not there. And here, one catch I like to tell you that usually we don't reveal to the patient. And that catch is that whenever you put this multifocal lenses, the distance vision suffers by 15 to 20% many times. Means clarity will not be that there. This is what we call contrast sensitivity will come down because it is a design of the lens which gives the problem. So 20. He may be able to see 6 by 6 there and may be able to end by 6 there. But the quality when compared with the monofocal lenses, it is definitely compromised. People say, can I get better vision that? Can I get better? Another thing is that in the night driving and all that, they may have the problem. To start with, a lot of people have the problem within 3-4 months it settles down, but few people may not be. Then comes to the trifocal lenses. It's a bit better lens. Night driving is more comfortable than the multifocal lenses, but not as good as the monofocal lenses. I'll still tell you, I admit, yes. But this is a very good active lens where the people can manage without the glasses. Whatever the myth is there that if you go for the trifocal or multifocal lenses, you will not require the glasses. Totally misconception. We say dependence on the glasses will be reduced. Take this word again. Dependence on the glasses will be less. That's all. But we never say that you will not have the glasses power. If somebody is telling is trying to do something wrong.
Right.
So these are the different kind of lenses are there. Then in between I mentioned about the intermediate lens. This is a combination of the monofocal lens, advantage of the monofocal lens and little advantage of the multifocal lens. Means in little distance, with especially for ladies, people who are driving, or if you want to see the mobile and all that, they can able to see without the glasses. And whenever they want to read, they can have the glasses, little power. Usually we see when we do the both eyes with the intermediate lenses, people are pretty happy. And other complications like I told you, contrast sensitivity loss, that is not there, or the this night driving problems, it's very less. So that is the what the myth is there. Now there are the different companies are there, different things are there, and one thing I have not mentioned is about the toric lenses. Toric lenses is one where the people are having the astigmatism more than say 0.75 or 1 diopter. There we are offering the toric lens also, which takes care of the cylindrical power. That's all. So this is the about the lenses.
Okay, so I think then the doctor's advice in this area becomes very key to really understand which lens would really work. Now that you mentioned a couple of segments of the procedure of how does a cataract surgery look like. Can you please walk us through the entire cataract surgery process, right from booking a consultation to finally getting the surgery and finishing the process? So what does it look like?
In very simple terms, I'll tell you. When the patient walks in the hospital, his refraction has been done, means they will check their vision. Then after check the vision, we'll do the intraocular pressure is how much it is there. Then we'll check the retina, and then we'll see if the cataract is there. If the cataract is there, we feel that it is significantly obstructing the patient vision. Definitely, we advise for the cataract surgery.
Okay.
Once the cataract surgery has been advised, we'll first go for the first few blood tests. What is the routine? Many people say, I don't have diabetes. Why you want to go for it? No, this is the routine. It has to be done because maybe one surprise in 100 or 200 cases also can prevent the loss of an eye. So few tests has to be done. What we usually do it that okay, blood sugar has to be done, BP has to be done, ECG if they required we will do it, or if any other communicable disease is there where we usually we do it. So to make the safety for the patient and other patient as well doctors and the staff also, the other few tests we do it. Sometimes when we feel that patient is having diabetes, then definitely we will ask for the physician fitness that whether the patient is ready to go for the or he is fit to go for the surgery or not, or if anything has to be done, or if the patient is a heart problem, he is on blood thinners. So we said, okay, you have to stop the blood thinner for few days after the consult of your this doctor. If any male person he is having on that prostate tablets, then definitely it has to be reduced. It has to be stopped for 1 week or 10 days. So like that only this test once we do. Once we feel that everything is good, then counselor will explain you whatever the things are there. And in our hospital, what we do that we usually start the some drops 1 or 2 days before the surgery.
Okay.
And we say that you put these drops. So one is the usually simple antibiotics to get your eyes cleaned. Another one anti-inflammatory sometime. In the day of surgeries, we dilate the eyes with the dilating drops, give one painkiller, do the surgery and come back. Now, as far as the surgery is concerned. Nowadays, 90 to 95% of the patients we are operating for the cataract surgery is the no injections. What we can say, no injection, no sutures and no bandage. Okay, this is a very old, 20 years back we used to it. Now we call this with the help of only the drops will operate your eye. So what we do that, instill one anesthetic drops. So your eyes is totally numb.
Yeah.
Then we do the surgeries with help of phaco or laser or whatever you say. So there are the different ways are there which I don't want to discuss. But if you say, I'll give you one example. Most of the surgeries are done with the help of the phaco machines. What in the phaco machine will do, after removing the first layer of the cataract that you all call the capsule, we will take out the nucleus through the phacoemulsification. And what phacoemulsification does, it will make it in very small pieces, just like a curd or paneer. And then we'll take it out all the lenses. So once it is there, we do the polish of the capsule inside. Then we put inject the intraocular lens. Then we'll seal it. No need of any sutures and all because it's all self-sealing. So patient can go right, straightforward. Just give the protecting glasses and say, okay, you put the drops into. Next day, usually we call them for the follow-up. If anything is there, we will correct. Otherwise, after 10, 12 days, he has to come and get the glasses and goodbye. So this is very simple. As far as the post-op care is concerned, I'd like to tell you that hardly there is no anything is there. You have to eat this one, you should not do this one, you should not do it. Yes, you have to take care for the 2-3 days. Yes, so fine. Because eyes are precious. So after 2-3 days, when doctors say you can start your work also, they can go to their office, they can start driving the car also after 3-4 days if everything is fine. Yes, maybe about 10% of patient will say you may have to wait another 2-3 years till the recovery because everybody's recovery cannot be the same. Right. It is not a stamping where you can do the all stamp same time. Correct. Okay, so it depends on what kind of cataract you are having, what kind of associated disease you are having, okay, what kind of lens we put it, what kind of pressures you are having in the eyes. So sometimes 5 to 10% cases may have some deviation, maybe 2-3 days here and there. But as I told you, the success rate is 99%. So that is good. Another thing you may ask me, but I will come first only, when they can go for the second eye operation.
About the cataract.
Because once we have done it, then another... See, there is no hard and fast rule in at all. Usually, our practice is that suppose if I done the operation today. Tomorrow I will have a check into the eye. If it is there, I will advise that you can go for the second eye day after also. But it depends. If the patient say, no, I want some more time, it is up to him. But why we are telling that you can go for the next day only? That we know that first eye is now well settled. Second eye, we can go for it. Same medicines, same investigations, same rest, same food, everything is same. And moreover that is that the development of the vision will be good. Because one eye, when you done the cataract, vision will improve quickly. Another eye is with again the dull. So effective vision will be dull only. Effective. It is just like that. If you are having the clear light and you are in the shaded light, the shaded light will have, but once you mix both, what will happen? Again, you will see some shade is there. So that is one. But still, what happened that in our country, people say, no. For 1 month, I have to do this. 2 months, I'll do this. It's okay up to that. But scientifically, I can tell that yes, or medically, I can say, I can go for the surgery after 1 or 2 days. Yes, I am very much against both the surgeries in one setting. Both the surgery in one setting. God forbid, anything has to happen. Who has authorized us to do the both the thing? If anything happens, the patient's life can be spoiled. Right, so I feel that one by one he has to go for. That is the one thing.
Right. 35 years is not a small journey, right? So, if you can share one case study of any of your patient that reminds you of the kind of impact you've been able to bring in their life, if you can share that, please, with us.
See, it is not 1 or 2 or there. See, in the hundreds it is there.
Right.
Okay, many people come with the both eyes not there. They have been rejected by everybody.
Okay.
And then they will do it. I'll tell you a very recent example. In one camp only, when we were in the Rajasthan, one dwarf patient, maybe about 2.5 feet. Single person, no parents, both eyes blind.
Okay.
Both eyes blind. Holding one stick in his hand. His neighbors they brought them and say, sir, if you can do something for him. He has gone to many places. Even the AIMS also. AIMS Jodhpur. They say, no, we can't do it in their patient. Some intuition. When I saw it, say, I can try for one eye, I know. Let us pray to the God, he should be okay. And then I said that who will take responsibility? Somebody has to sign. So their neighbors, they say, nobody is there for him, sir. Only we are there. I say, you sign it. We took him to the base camp and we operated. Won't believe the pleasure on that person's face. From last many years, he's not seen anything except the light also sometimes fade. And now he was starting walking by himself.
Wow.
I think this is the one thing what I feel that as an eye surgeon, we are having that opportunities always.
The purpose.
Because here what happens, the response and result is quick, next day only. In other surgeries, if you got for heart surgeries or got for any abdominal surgeries or your bone surgeries, it takes time, weeks together. Okay, but here instant.
Right.
And sometimes it pleasure also and pain also.
Right.
Pleasure is that if person is happy, okay, everything is good. But pain is that, sir, whole night I was not able to sleep. Why? What happened, sir? I was having all the blur. I say, you please wait for 2-3 days. Not in a day or you will see. So what I do, pain for the patient and pain for us also many times. Wait. It takes its own time. It may take 48 hours, 72 hours, 4 or 5 days. Sometimes, as I told, that lot of associated diseases are there. So that is pain. But one thing, as I told you, that as a eye surgeon, we feel that we are very blessed people. Very blessed. Where the people say and give the Ashirwad.
That sounds very inspiring. Maybe I'm here a little selfish, probably requesting you to share another case study from your journey again, maybe from any of the stakeholders that you're working with, different patient that you're working with, right? So, yeah.
No, there is another one case I told you that both eyes not been able to see, nobody is there with them. Many times in our hospital, the people, we bring them to the from the camps also. Okay. So, and we do it. But one, I will like to tell you, he is not come from the camp.
Okay.
He has been brought by their relative from Rajasthan. And they say, sir, this person is not able to say anything from last 6 or 7 years. We are shown here and there and all that. One eye, when I saw the one eye, it is hopeless. We cannot do anything. But other eye, I saw some reaction in his pupil. When you put the light, it started to. I say, there is a hope. I told their relatives, see, everybody has raised their hand, but I am putting my hand. But please don't blame me if it doesn't come. They say, Doctor Saab, anything he is not able to see. You do whatever you want it. And I can tell you, when I operated surgery, at the time I was doing operation only, I was knowing that his patient is going to see now.
Wow.
So at that time, we used to put the band-aids and all that. And next day, when he came and opened the band-aids, I can tell you the moment he jumped.
Oh, so good.
Jumped in the sense that, okay, because he said, no, my whole word is gone. And he started touching my feet, and I say, no, I had done my job. I had done my duty. I had not done anything else. It was your luck. Then God was very kind to you. Then you got it. I was just media and my media, nothing else is there. Another one I like to give for a small kid.
Okay.
That kid was about 6 months old.
Just
6 months old. Having congenital cataract both eyes. Congenital means by birth he was having the cataract.
Oh, okay.
So after 2 months or so, 2 months of this baby's age, parents know that he is not following the movements usually. So he is not following the movement. What is happened? So he went here and there. And then they say, we can't do it. Now at the time they came to me and I said, okay, I'll do it. Don't worry. But it may be a 2-stage surgeries. I will do the 2-stage surgery. First I will remove the cataract. Maybe after 2 or 3 years, I may have to implant the lens. They agreed and I did the needling process at that time. And the boy started seeing it. And after 3 years or so, when I saw that one, it was good. Now that patient is 28 years old.
Oh, okay.
Still coming. His name is Lokesh. And he is my free patient always.
Wow.
One Lokesh and then his 2 twins was there. Both the twins I operated.
Okay.
And whenever they come, they bring something. They are very poor, from poor family. So that makes sometimes we feel that we are blessed, as you told, we are blessed people. But eye surgery is one where all miracles happens.
So, quite inspiring again. Thank you so much for sharing that. So now we move to our Mythbuster section, as I said, to get our quick focus, where I would request you to answer in true or false statement and with a reason why. Are we ready, sir?
Yes.
Perfect. So wearing glasses makes your eyes weaker over time.
Totally myth. The reason is glasses never make more stronger, in fact. When you were not able to see, you put the glasses, you are able to see it. The strain on your eyes are less, your eyeball is less, muscles is less. Okay. So wearing it is always good. It gives the relaxation. And it sometimes it can even reduce the growth.
Okay.
That's it too.
Okay, your next myth is reading in dim light ruins your eyesight.
Yes, this is the truth. If you are reading in the very dim light, I'll give the example, the 2 things. One is that kids and another is the old age, means maybe after 40s. So kids, when they are reading in the very low light, since their accommodation is too strong and the light, when it is less, they have to, more accommodation they have to do. They may develop the latent hypermetropias. Okay. So always better if they can read in the normal lights or natural lights. After 40, definitely everybody feels that if the light is good, I am able to see properly. So they have to use the good light only. So lesser light is definitely not good for it, because our eyes are used to that brightness only.
Correct. Interesting. So then we move to our myth 3. Once you have a cataract, you must wait for it to ripen before the surgery.
No, it is purely a myth. There is no age limit that when cataract has to be operated. Simple example I told, the vision. If you are not comfortable with your vision, if your day-to-day activities or occupational things are getting affected, you should get it done. Okay. Don't say it is a grade 1 or grade 3 or grade 4 because cataract is not only one thing, because if it is the center, it may be +1 cataract, but the distortion of vision is too much.
Okay.
Okay,
Okay.
if it is the peripheral cataract, even if the grade 3 or 4, they were able to see. So, but quality of vision comes down.
Hmm. So then children don't need eye exams unless there is an obvious problem?
No, as I mentioned before, also I like to tell you that if once you have had the strong family history of wearing the glasses, they should go for third or fourth year. If the kid is going again near to the TV or so, or if he is reading the books very near, they should go for this one. I
Okay.
don't say that everybody has to go, but nowadays, I think government has also come with some circular that all the kids has to be get at the age of 5. They should go for the eye test, mandatory, whether it's the government
Okay.
or in the any mandatory.
Okay.
So they will have the health assessment form in that eye is one, eye, ears, and teeth. These three things are there.
Interesting, interesting. So now that we know there are like allopathy, Ayurvedic, homeopathy, and so on. So my next myth is about Ayurvedic eye drops can treat glaucoma or cataract.
See, I'm not authority on that, but I like to tell you. Yes, they claim that the glaucoma it helps a lot in their Ayurvedic drops in health. I have not seen any single patient who has been because those patients never turn up. But if it is true, because I do always believe that Ayurveda is one with a big science which has not been explored properly. But try to see that you should not go to the quacks and who says you put these drops. So then you will have a problem. If you have got anything, what I'll suggest them that okay, whatever the drops they are giving you, please use it. But come and check it with the equipments or gadgets, whatever the intraocular pressure or their optic nerve conditions or so. And if it helps, nothing wrong in that. But it doesn't help, or then definitely you should switch on to the stabilized treatment.
Fair enough. Fair enough. I think like any person like me who is part of the audience have thought very different from what you shared today, and probably that has opened up doors to many other follow-up questions which I think consulting a doctor would really help us, right? So moving ahead from the myth segment, getting a future perspective, I would say, Solanki sir, 35 years from now on, 35 years gone by, 35 years from now on, when we are all gone by, right? What do you want the Dr. Solanki Eye Hospital to stand for? What is the legacy do you want it to continue on?
See, whatever the principles we have followed till date, those principles should not get diluted. Number one is patient faith, your honesty toward the patient. Whatever it may be, compulsions, you should not come under those compulsions and give your honest opinion, honest treatment, and don't let any patient to go because he is not able to afford. You can do in subsidized also, and sometimes you can do the charity by yourself also. Your patient is not afford. I can do free. What I am going to lose doesn't matter. But what happens? Anybody's life, anybody's faith on you is more important than anything else.
So true.
So what we say that ethical treatment, number one, it should be professional treatment. Number two, it should be service oriented, and it should be economic. These all four pillars one should follow. Then I can tell you that what we have built this one, it should go further, whosoever it may be. For me, it is most important that what are the name we have made it, what are the values we have created in that. Those values, I don't think that anybody will dilute it in any way. That is the one thing.
My God, I mean, your journey definitely has proven that when there is a collective effort, there's one individual focus and ambition to make a world better place. I think the entire village will join you to make that dream possible. Thank you so much, Dr. Solanki sir, because 35 years of legacy, 500,000 patients, and still going. Trust me, it's not an easy thing. You have made this world a better place, and you are continuing to grow this place, a better space for anybody who needs that service. Maybe those who are watching us today, most of you might have been part of this family too. Many patients, many families, many children who would have restored their vision here, right here at Solanki Eye Hospital. If you are, trust me, the story is yours too. And with this, I'm telling you, if you or your loved ones have been putting off their eye checkups or are really afraid of consulting an eye doctor, trust me, Dr. Solanki Hospital is your space to book your appointment. The link is in your description. Ensure you do not miss it and please take care of yourself. See you in the next episode.